The amount of sleep each person actually needs. Are you tired of hearing most adults say that everyone needs 8 hours of sleep every night to function the next day? Well, I'm here to tell you that that is a myth. My main points will be about the 8 hour sleep myth, the quality of sleep over the quantity, and the different approaches to get better sleep. Okay, so the 8 hour sleep myth. The 8 hour sleep myth is the saying that everyone needs 8 hours of sleep each night to function the next day. The reason that this saying is a myth is because each person needed hours of sleep per night is just as unique as they are. When it comes to sleep, there are usually recommended hours for each night, but these are not strict rules. Some people might not need more than 7 hours, while others could require more every night. Sleep patterns change over time. Many people are not going to sleep in their 60s and 70s exactly like they did in their 20s, explained Eric Zhao with the Division of Sleep Medicine at Harvard Medical School. Most sleep changes are age-related and deal with how much deep restorative sleep your body can handle each night. The production of the sleep hormone melatonin decreases as a person ages. That's why older people tend to get less sleep and wake up more frequently throughout the night. For kids, getting their recommended amount of sleep regularly is linked with better health, including improved attention, behavior, learning, memory, the ability to control emotions, quality of life, and mental and physical health. For adults, getting less than 7 hours of sleep a night has been linked with poor health, including weight gain, having a higher body mass index, diabetes, high blood pressure, heart disease, stroke, and depression. While sleep needs vary significantly among individuals, there are still general recommended guidelines for each age group, but I'll get into that with the next slide. Another sleep myth is that you can catch up on your sleep in later time. Researchers are finding that this is not the case. If you have one bad night's sleep and take a nap or sleep longer the next night, that can benefit you, says Wright from the National Institute of Health. But if you have a week's worth of getting little to no sleep, the weekend isn't sufficient enough for you to catch up. That's not a healthy behavior. In a recent study, Wright and his team looked at people with consistently deficient sleep. They compared them with sleep-deprived people who got to sleep in on the weekends. Both groups of people gained weight with lack of sleep. Their body's ability to control blood pressure levels also got worse. The weekend catch-up sleep was not helpful for either group. Deciding how much sleep you need means considering your overall health, daily activities, and typical sleep patterns. Okay, so this was the recommended age groups, and as you can see, as you go over it, it'll tell you about how much sleep each age group needs. For example, I'm going to come around so I can point at them each. For example, as it explains that infants 4 to 12 months need at least 12 to 16 hours per 24 hours, including naps. 1 or 2 year olds are recommended to have 11 to 14 hours per 24 hours, including their naps. 3 to 5 year olds are recommended 10 to 13 hours for 24 hours, including naps. 6 to 12 year olds are recommended 9 to 12 hours for 24 hours. 13 to 18 year olds are recommended 8 to 10 hours, and adults are recommended 7 hours or more every night. Okay, so some questions that could help to figure out your own sleep needs include: are you productive, healthy, and happy with 7 hours of sleep? Or have you noticed that you require more hours of sleep to function better throughout the day? Do you have coexisting health issues that might require more rest? Do you have a high level of daily energy expenditure? Do you frequently play sports or work in a labor-intensive job? Do you have daily activities that require alertness to do them safely? Do you drive every day? Do you feel tired doing these activities? Are you experiencing or do you have the history of a sleep disorder? Do you depend on coffee to get throughout the day? When you have an open schedule, do you tend to sleep in more? These are questions that could help benefit your sleep schedule. Okay, so quality over quantity. Quality of sleep is more important than how many hours of sleep you get. That's what we should be more focused on. Quality sleep means how well you sleep during the night. Did you sleep straight through, or did you wake up during the night? Could you go back to sleep? How did you feel waking up in the morning? If you feel refreshed in the morning, then the hours of sleep you got should not be as important as the sleep foundation. How does sleep affect your health? Sleep quality is vital for our overall health. Research has shown that people with poor sleep quality are at a higher risk for heart disease, stroke, and mental health issues, like anxiety or depression. Poor sleep can also increase daytime fatigue and make it harder to enjoy everyday life. If your sleep is frequently interrupted, you're not getting quality sleep. Previous sleep deprivation, and if you are sleep deprived, you will need more sleep each night. Start by making sleep a priority in your schedule and not putting it off for other activities. It won't pay off in the long run because sleep is essential for you to be at your best. Different approaches to get better sleep. How can you treat sleep quality? How can you track sleep quality and the factors contributing to it? One way is to keep a diary to track and record your sleep. You would record when you go to bed, how long it took you to fall asleep, if you wake up during the night, and what time you wake up, then how you feel throughout the next day. After a few weeks, review your notes and see if there's a visible pattern that could be affecting your sleep quality. One example could be that if you're having trouble falling asleep, to go to bed half an hour later than usual, but maintain the same wake-up time. It is not a good idea to stay in bed longer as it disrupts your sleep pattern and hurts your sleep quality. Other strategies that can help support good sleep quality include keeping a consistent wake-up time throughout the entire week, even the weekends, when it comes to sleep, and limiting naps to no longer than 30 minutes and not close to bedtime. When it comes to sleep quality, consistency is vital, and it is unrealistic to expect perfect sleep every night. And one night of restless sleep could be due to anything in life, including eating a lot before bed or having a stressful day. When tracking sleep quality, it's important to track overall sleep quality week to week and not one day compared to another. If nothing you do helps your sleep, then it might be important to see a doctor to rule out any sleep disorders. And other factors that could lead to sleep quality is taking medications, depression, anxiety, loneliness, and environmental changes. The most common sleep disorder is insomnia. Insomnia is described as difficulty getting to sleep and or staying asleep from the sleep foundation. This happens despite having the time to sleep in a proper sleep environment and affects your everyday life throughout each day. Sleep apnea is another common sleep disorder. In sleep apnea, the upper airway becomes blocked during sleep. This reduces or stops airflow, which wakes people up during the night. It can be dangerous if untreated and lead to other health problems. Cognitive behavioral therapy can help many people with insomnia get better sleep, and medications can help others. Many people with sleep apnea benefit from using a device called a CPAP machine. These machines can help keep the airway open so you can breathe. Other treatments include special mouth guards and changing lifestyles. To get a better night's sleep, it's best to stick to a schedule every day. You could get exercise, enjoy the outdoors, avoid nicotine and caffeine as they are both stimulants to keep you awake. You shouldn't take naps close to bed and avoid large meals close to bed. You should limit technology before bed. You should create a good sleep environment and get rid of any distractions. And then if you're tired and laying in bed but can't sleep, get up and move around to become even more tired, because that can actually help. It is important to be consistent with sleep and figure out what can help you. Okay, so first I'm going to go over my main points, which were the 8-hour sleep myth, quality over quantity, and ways to get better sleep. The 8-hour sleep myth was a saying that people should get 8 hours of sleep every night, which we now know isn't true. Quality of sleep is more important than the quantity, and there are multiple ways to get better sleep, and you just have to be willing to put in the work. As sleep is important to many aspects of your health, and getting quality sleep is very important. Everyone's sleep needs are unique, and not everyone has to have 8 hours of sleep. Some people need more and others need less, and there are ways to improve your sleep, but you have to put in the work to help yourself. And the most important factor to remember is consistency. And this is my works cited.